People are paying premium prices to sit in a clinic and have their faces intentionally punctured by thousands of sterile needles. If that sounds intimidating, the treatment's internet reputation is likely to blame. You have probably seen sensationalized vampire facials on social media, or read about people causing serious damage to their skin at home with cheap rolling devices. The risks of untrained practitioners are entirely real. In 2024, the CDC announced that multiple clients contracted HIV after receiving unregulated vampire facials at a New Mexico spa, highlighting the extreme dangers of poor infection control. But strip away the internet hype, the bad clinic practices, and the bathroom DIY kits, we find a highly respected procedure known as collagen induction therapy. Distinguishing those dangerous, unregulated trends from the actual clinical science shows how intentional injury goes from a potential horror story to a highly effective medical technique. The core difference comes down to geometry. An at-home derma roller is a wheel covered in needles that tends to drag and tear the skin at a 45-degree angle. A professional motorized micropen stamps the skin with clean 90-degree vertical entries. Because the clinical pen is motorized, practitioners can precisely adjust the needle depth up to 2.5 millimeters in real time. This allows them to safely match the specific topography of different facial areas, like the delicate skin around the eyes versus the thicker skin on the cheeks. And before the device even touches the patient, a medical-grade topical numbing cream is applied for up to an hour, making the actual procedure relatively painless. Creating these clean, controlled vertical microchannels is biologically required to safely stimulate the skin's repair systems. Tearing the tissue risks permanent scarring, but a clean puncture provides the exact stimulus the body needs to rebuild. Those vertical channels initiate a very specific biological trick. The micro-injuries simulate an emergency, triggering the skin's natural trauma repair response to kick into high gear. The body immediately starts shedding old, damaged cells and floods the localized area with fresh collagen and elastin, the essential proteins that keep skin firm, smooth, and stretchy. This is where platelet-rich plasma, or PRP, enters the picture to demystify the so-called Waldmeier element. PRP is simply a concentration of healing growth factors isolated directly from the patient's own blood. To get that plasma, a clinic draws a small amount of the patient's blood and spins the vials in a centrifuge to separate the yellow platelet-rich fluid from the red blood cells. Applying this concentrated PRP directly over the fresh microchannels allows those growth factors to bypass the tough outer skin barrier, seeping deep into the tissue to accelerate the recovery process. By combining an intentional physical injury with a concentrated dose of natural growth factors, the procedure hacks the body's aging process at a cellular level. The immediate physical aftermath of the procedure requires strict care. For the first 48 hours, patients experience sunburn-like redness and peeling and must completely avoid sun exposure, makeup, and heavy sweating. The treatment also carries strict medical contraindications. It is unsafe for pregnant women, individuals with active skin infections like severe acne or eczema, and patients taking blood thinners. This chart shows the timeline required for actual visible results. Because collagen remodeling takes time, patients usually need a series of 4 to 6 sessions spaced several weeks apart, with peak synthesis occurring 3 to 6 months after the final treatment. Because microneedling relies on biological tissue remodeling rather than instant artificial fillers, extended patience is the biological cost of achieving natural results. True collagen induction therapy is a precise medical process that harnesses the body's own immune system, not a casual spa day or a DIY bathroom project. Safely and effectively triggering those regenerative superpowers requires sterile tools, targeted depths, and the supervision of trained medical professionals. For more information, check out the article link in the description.